But what is much less recognized is the power of plant-based diets in treating existing disease. And so I think we need to take a little bit of a look at that. So what we know in terms of heart disease reversal is that plant-based diets, as far as I understand, are the only diets that have been shown to actually reverse coronary heart disease. And the first studies we had were really from Dean Ornish, and if you remember 1990, the lifestyle heart trial, and this was the study I thought would change the world and the way cardiologists practiced, and it didn't, which is shocking to me. But Dean Ornish took people who had such severe disease, they were told there was nothing more that could be done for them. They'd already had, the triple bypasses and everything else they could have. And so most of them were given a fairly short time to live. And 82% of his participants experienced reversal. The experimental group, and they compared, this sort of very low-fat vegetarian diet and exercise and stress management and so forth with a sort of conventional step one diet for cardiovascular disease. And the experimental group had 2.5 fewer events in the 5-year follow-up than the control group. I think Dean Ornish has gone on to do some other work, which we'll talk about later, but this was really quite revolutionary because we didn't think at that time that you could actually reverse or decrease the size of plaques in blood vessels. And so this proved we could reduce the size of plaques in blood vessels, and that was, to me, pretty earth-shattering. But what physicians always told me when I was giving talks was, well, that's all well and good, we believe it, but my patients would never do that. And my answer has always been and will always be, your responsibility as a physician is to lay the options out on the table. It's your patient's job to decide what they can or cannot or will not do. And at the very least, you have an obligation, a responsibility to lay the options out on the table, because you know what? Some people who you would never suspect might choose to eat a healthy diet as opposed to having their chest cut open and be on medications for the rest of their lives. So I think that's just the important point there. And Caldwell Esselstyn did a sort of similar study, but in his, he did not use the sort of exercise and stress management. It was really strictly diet. In some cases, he used statins. But 72% of the people in his cohort actually experienced reversal. And his follow-ups were even more positive than Dean Ornish's, because he literally had nobody who followed the program that had any kind of recurrence. So it was really quite astounding. But again, he used a very low-fat vegan diet. And Dean Ornish's wasn't completely vegan, but Dr. Esselstyn's was. And then in 2014, he had 198 patients, 177 that did the program and stuck to the program, 21 that were non-adherent. And the recurrence rate was 0.6% in adherent patients and 62% in non-adherent patients. 13 out of 21 people had an event. And if this wasn't, it was a self-selected group, there wasn't a control, it wasn't randomized, it wasn't kind of the gold standard clinical study that we need. But it was still, the results were so compelling that it should tell us we need to do more studies on this. Cancer, well, cancer's hard because you can't just take a group of cancer patients and say we're going to randomize half of you to the gold standard of treatment and the other half will do this diet. It wouldn't pass any sort of ethical boards, so it's a little tougher. But we have preliminary evidence that shows that well-planned or well-designed plant-based diets inhibit cancer cell growth, reduce DNA damage, improve DNA repair, lower IGF-1 levels, favorably alter gut microflora, reduce levels of a variety of toxic metabolites, and just do a variety of things that make your body better able to deal with carcinogens. And we actually have some really interesting research from Dean Ornish on prostate cancer. And the reason this worked is because he took men with early stage prostate cancer who elected not to receive any treatment because they didn't really need it yet. He had 49 people in a control group and 44 people in the lifestyle intervention. He used the same kind of lifestyle intervention that he used with his cardiovascular disease patients. And after 1 year, 6 people in the control group they started conventional treatment because their disease had progressed to the extent that they felt that they needed treatment. Nobody in the lifestyle group started treatment. PSA dropped 4% in the lifestyle group and increased 6% in the control group. But what was most amazing to me was serum from the lifestyle group inhibited cancer cell growth almost 8 times more than serum from the control group. So this was quite interesting. And then in 2008, he released a study where I think it was about 30 men in this study, followed for about 3 months, put on a plant-based diet, and all the usual lab measures improved. But what was the most stunning about this study is genetic expression changed. Nearly 500 cancer promoter genes were downregulated, and nearly 50 cancer preventing genes were upregulated. And this was huge. We could actually change the expression of our genes by changing the food we put into our bodies. So very, very important research. And then in 2013, a 5-year follow-up, he actually reported on the telomere length. And this was just shocking because telomeres are the little things at the ends of our chromosomes that basically tell us how long we might live if we don't get hit by a truck, right? And so what normally happens is as you get older, they get smaller and smaller and smaller. But people who were adhering to this, sort of lifestyle change, their telomeres actually increased in size, where of course the control group, their telomeres got predictably shorter. So, and again, this was really quite a revelation. We did not know that we could actually increase the length of our telomeres by simply changing our lifestyle. What about diabetes? Well, treatment of diabetes, PCRM has done a number of small studies that have compared a vegan diet with a conventional diet. And both the low-fat vegan diet and the American Diabetic Association diet improved glycemic and blood lipid control, but the improvements were consistently greater for those consuming the vegan diets. In Europe, the Czech Republic, they did some studies comparing a near vegan diet. There was a serving of I think, low-fat yogurt per day. That was the only animal product. And they compared that to a conventional diabetes diet. And the people on the vegetarian diet had better, more improved insulin sensitivity, reduced medications, reduced visceral fat. They had reduced oxidative stress markers. They reduced their LDL cholesterol levels. So a number of positive changes. And then I want to just take a couple of minutes to tell you about the research that I've been involved with in the Marshall Islands. And the Marshall Islands have among the highest rates of diabetes in the world. 80 years ago, diabetes was pretty much unheard of in the Marshall Islands when people actually lived off the land. So they ate plants and, of course, the fish they could catch, and that was pretty much it. Now, the Marshall Islands, for those of you that don't know, are somewhere between, about halfway between Hawaii and Australia, in the middle of the Pacific Ocean. And there's nothing within 2,000 miles in any direction of the Marshall Islands. They're very, very isolated. And I went there in 2006 and was involved with a study looking at a very aggressive lifestyle intervention program compared to the usual care. We had 169 participants and 5 overlapping cohorts, so 5 different groups of people. And just to make a long story very short, fasting sugars dropped 71 points in the first 2 weeks of the program on average, and close to 50 points by 12 weeks. A1C dropped about 2 points by 12 weeks on average. HOMA-IR, which is a measure of insulin resistance, dropped almost, 2.5 to 3 points. CRP, which is a measure of inflammation dropped 1.2 points at 12 weeks and stayed that way. So the really quite significant findings. Now, I go back pretty much every year and continue to do work there. And in 2014, we achieved an average blood glucose drop of 119 milligrams per deciliter, or 6.6 millimoles per liter, which is just absolutely stunning. We did an eBay in another little island called, another intervention in eBay, which is a little island that, just wrap your brain around this, it's 0.14 square miles with 15,000 people. So it's just absolutely packed with people. There is no room for growing produce. We brought in 170 earth boxes so that people could grow in these little boxes, but even that's hard to find space for. And we achieved an average glucose drop of about 50 milligrams per deciliter. We were back in 2016 doing an intervention for Bikini Island folks, which is the island that the atomic bomb testing was done after the Second World War. And the average fasting glucose drop we achieved there was 63 milligrams per deciliter. We had over 11 participants with drops of over 100 milligrams per deciliter.